Good morning, everyone. You have found yourself at Miller Johnson's COVID webinar that we've entitled Ask Us Anything About COVID-19. I'm here with my colleague, Nate Plantinga, and we sent out a message that we would answer any questions that our attendees have this morning about COVID-19. And I'm happy to say you guys definitely delivered. So Nate and I are excited to go through your questions. Couple of things before we jump in and get started. There were, not surprisingly, there was some overlap in some of the questions we got. And so we're going to be combining some of them in our responses. Okay, so if we don't read exactly the question you got, it's because we believe we are answering it maybe in a differently worded question. Also, we had a few, maybe 2 or 3 questions that we received, and we weren't quite clear on exactly what the individual was asking. I'm sure that's our fault, not yours. So if you feel like we didn't touch your question at all, reach out to us and we will answer it separately. We just had some follow-up questions or needed some clarification. Okay, so with that, thank you for joining us. We are just going to jump right in. The way this is going to work is you are going to hear both Nate and I get tested a bit. So we're going to go back and forth and ask each other the questions and provide the responses. Okay, are you ready, Nate?
I mean, I'm as ready as I'm going to be.
Nate's been up all night studying for this COVID final exam, so bear with him. He's got a giant, actually, I know Nate well enough to know he's got a giant Starbuck, one in each hand.
That is true.
And so he is ready. All right, Nate, we're going to start off. With an excellent question, and it's a question probably that almost every one of our listeners wants an answer to this week. It is, can an employer require employees to be vaccinated?
Yeah, and that is a question that we are predictably getting a lot. There isn't any guidance from any of the 6,000 agencies that have been ruling our lives for the last 8 months that addresses that question directly. But we think the answer is pretty clearly yes. And the reason we think that is that we have a pretty good analogy in mandatory influenza vaccines. And certainly a lot of our healthcare clients require employees to get the flu vaccine. And I think notably, a lot of healthcare clients require all employees to get the flu vaccine, whether or not they are employed in a clinical capacity. And that practice is a legitimate, non-discriminatory business policy. And if you impose it, there are really only 2 obvious considerations, and they're the same 2 considerations that you wrestle with if you have a flu vaccination or if you've ever evaluated a flu vaccination. And they are, number 1, that you have to accommodate any individual with a disability who may be, for reasons associated with their disability, unable to tolerate the vaccine. Or even if the person doesn't technically have a disability, they might have some medical contraindication. And I think that anybody who's going to require the vaccine is going to want to allow for the possibility that some presumably small portion of their employee population is going to be medically intolerant. And so whatever program you put in place to evaluate people's requests for exceptions to this, and you will get them. We'll talk about that in just a second. I think you have to allow for employees who can provide medical evidence that the vaccine is problematic for them in some tangible fashion. The second exception is the exception for a religious objection to the vaccine. And there are a surprising number of people who object to vaccines in general on faith-based grounds. And remember that the courts look at religious accommodation much more broadly than you might think, or at least, they look at whether or not somebody has a religious objection much more broadly than you might think. So it doesn't have to be tied to some specific denomination. It doesn't really even technically have to be religious. It can be spiritual. It can be any sort of belief that the person holds with the conviction of a traditional religious belief. And so if somebody has a religious belief, you have to go through the accommodation process there too. So that's a long way of saying, yes, you can do this. You have to account for medical accommodation. You have to account for religious accommodation. And you're going to want to plan that on the front end to make sure that you're comfortable with how you're going to address those things. But if you do, then you can put this in place. I do think that as a practical matter, we are likely to get pushback from portions of the population. Obviously, COVID and particularly masks have become politicized. There are people who don't believe in COVID or don't at least believe in the need to do anything about COVID, and certainly don't believe in any requirement that they do anything about COVID. And somebody who is already opposing wearing a mask is likely to oppose even more the idea that you're going to inject something into their bodies. So I think there are practical challenges to this. And if you're considering it, and a lot of employers are, and I suspect a lot of employers, maybe a majority of employers, are going to require this. And I certainly think that's a good idea, but I think some planning is required on the front end.
Thanks, Nate.
Some of our answers to your questions will just be yes. They won't be that long.
They won't be that long, but I know that's a big one. And I'll point out to the listeners, too, we've got a 2-part webinar series on Thursday and Friday this week on vaccines. The first one is going to be a chat with a health expert explaining the timing of the vaccines, what they are, et cetera. And then on Friday, we're going to talk more about employment considerations related to vaccines. So tune into that. Okay, what do you got for me, Nate?
Well, I have this question. Can you use tax credits under FFCRA if you also got PPP?
Great question. We actually got that a few times. And I'm going to take a leap of faith and guess that this person is asking whether an individual employee can both be paid with PPP money and claim a tax credit under the FFCRA, right? So can you pay an employee with PPP money and also call it emergency paid sick leave or emergency FMLA under the FFCRA and take the payroll tax credit for that same amount? That answer is no, you cannot do that. However, there is no rule under either the PPP, the portion of the CARES Act that provides for the PPP program or the FFCRA that one entity can't take advantage of both, right? So you can have an organization that received PPP money and also take advantage of the payroll tax credit program under the FFCRA. It's just that you can't do it for the same money you're paying one employee during the same week. Boy, that may have been a confusing response, and I apologize if so. I do know it was a lot of acronyms, so I hope that response is helpful and that nobody was driving while trying to listen to that.
Yeah, just don't do it at the same time, right? So,
yeah. I mean, thanks, Nate. That's 3 words, I think. So, what about this? This is a question, Nate, that I know I'm getting a lot. Do employers have to report a positive case to the health department if an employee is working remotely? So employees not in person in the workplace, working remotely, yet informs their employer that they've tested positive.
Yeah, and I think the answer to that is yes. And I also think it's one of the rare cases in all of this entanglement where it's a good yes. I mean, you can talk about the fact that it's required and yet another, administrative box to check. But it's an easy opportunity to demonstrate that you, as the employer, are fully in control, that you have a plan, that you are transparent, that you aren't hiding the ball from your employees, that you're working to keep them safe, that you are collaborating with state and local health authorities, and to do all of that in this example anyway, in a very safe context, because the person's working remotely. So in all likelihood, it's a no harm, no foul situation. So you get to remind everybody of all of the steps and the measures that you have taken over the past 8 months to try to make sure that they stay safe and that they stay healthy without creating alarm. And really, this to me is a subset of a lot of questions about situations where the employer finds out that somebody is positive or that somebody had close contact with someone who was positive. 17 days after the employee, was sent home, or after the quarantine period has already run, because it takes a while for people to get tested, and then it takes a while for the results to come back, and then it sometimes takes a while for people to tell us about their results. And all of those situations, are lumped together with, well, do we even bother? Because it's sort of a moot point. And A, you have to bother. That's the requirement. But B, I think that's the perfect opportunity. It's hard to notify everybody when you're going to have significant and widespread consequences, and where contact tracing is going to capture a whole bunch of your people, and they're going to be nervous and anxious. It's easy when you can tell people, hey, this happened. We're committed to telling you when these things happen. But hey, good news, this person works remotely, and we don't have any reason to believe that anybody had close contact. But we're going to work together with the health department anyway. So I think it's a good opportunity. I think anytime you give notice to your employees, you ought to take that opportunity to remind them of what you have done, so that they're looking to you. They're not hearing things from the rumor mill, and they don't get suspicions that you are, elevating profits over people. All right, I need to shorten my answers. That's what I've learned. So let's turn to you. Do you feel that FFCRA will be extended in next year, or will it expire as stated on 12/31/2020?
Well, this is where I wish I was on camera and could pull out my magic 8-ball, Nate, and let you know what the magic 8-ball says about the answer to that question. The short answer is we don't know. I don't think it looks particularly optimistic for that occurring, quite frankly. And I wouldn't have said that in the summer. I would have assumed that Congress would act to extend the FFCRA if we were in the position we're in right now, namely that it certainly doesn't appear that COVID is going to go away by the end of the year, unfortunately. But it doesn't appear that Congress is likely in a position to do something like that. They are scrambling now to pass the budget to avoid a governmental shutdown. And we are not hearing any specific talk about the FFCRA being a priority. So it would not surprise me if the FFCRA simply sunsets at the end of this year and we come back in January and start all over with something else. All right. How about this one, Nate? Turning to emergency paid sick leave under the FFCRA, does that time have to be used in 2 consecutive weeks? And also, does the usage depend on the employee's schedule, or it sounds like this person's wondering to just automatically pay it in a 2-week chunk, even if that employee wasn't scheduled to work during those entire 2 weeks?
Yep. So the answer is no. It does not have to be used in 2 consecutive weeks. And frankly, as long as the person's reason for leave qualifies, they can use the 80 hours in 2 different scenarios, 3 different scenarios, 4 different scenarios. Usually, given the length of quarantine that's associated with a qualifying trigger for emergency sick leave, you don't have multiple increments, but it is possible and it doesn't have to be consecutive. In fact, there are provisions for intermittent emergency sick leave, which are pretty specific and tied to what the person does and whether they're teleworking. Second, can their hours be based on schedule? They can be and they should be. So the FFCRA has provisions for full-time employees, and theoretically that's what this 80 hours is based on, right? 2 weeks of 40 hours each. But they also have provisions for employees who always work overtime or at least routinely work overtime. And the idea there is that you pay the employee more than 40 hours of emergency sick. Let's say they regularly work 50 hours. Well, then you can pay them 50 hours in week 1. They're only going to have 30 hours left in week 2. It doesn't change the 80-hour cap. And if an employee is part-time, then you're going to pay them based on their average hours of work on their part-time schedule. Again, up to 80 hours. So no, doesn't have to be 2 consecutive weeks. Yes, can and should be based on schedule.
Excellent.
Oh. All right. Next question. For expanded FMLA, employers can require employees to use accrued paid leave time. Can you please explain how this works?
Excellent. So we're talking here about the emergency FMLA under the FFCRA. And just as a reminder for our listeners, that emergency FMLA provision applies when an employee is home taking care of their kids because their school or place of care is closed for COVID reasons. Okay, so that's specifically what we're talking about. Employees have up to a total of 12 weeks to take for that reason. And this is going to, I'm warning you now, this is going to be a bit of a complicated answer again. I'll try to avoid so many acronyms as I used in my last answer. So for that leave, the first 2 weeks of that leave can be paid via the emergency paid sick leave under the FFCRA. So that's those 2 weeks that Nate was just referring to, or otherwise known as 80 hours. Okay, so for those first 2 weeks that we can use that emergency paid sick leave. After that, that employee has up to 10 weeks left, okay? For those 10 weeks, there are 2 options. They are either paid at 2/3 provided by the FFCRA, for which you can take a payroll tax credit to recoup your money that you pay that employee, okay? Alternatively, if you want to force that employee to use paid vacation or personal time, you can do that. The downside, however, is you can't recoup that money via the payroll tax deduction. So it's one or the other. They either get the paid time under the FFCRA and you can get it back through your payroll tax credit, or you can force them to use their personal time or vacation time. All right, moving on, Nate. This is a question, a variation of a question that we got a lot of, involving quarantine and isolation. So in this question, this employee tests negative, but then the doctor tells the employee to stay home anyway because the employee has symptoms. Does that person get emergency paid sick leave because they tested negative, or do they still get it because they're home with COVID symptoms?
Yeah, and I think the answer to that is yes. And, you know, everyone on this call is aware of the fact that the law has changed back again, changed yet again, over and over again. I mean, it's been a tumultuous year, and whether an employee tests negative has had all kinds of different levels of significance at some points in time, and no significance at all, seemingly, at others. But for this particular question, I think the answer would have been the same from the start of this period to today, because at the end of the day, when you look at FFCRA and somebody's entitlement under that statute, you just look at whether one of the triggers is satisfied. And one of the triggers is that the employee has been advised by a healthcare provider to quarantine for COVID-related reasons. And so in this question, as it's phrased, it sounds to me like we hit that trigger squarely. The employee has been advised by the doctor to stay home longer to address symptoms, and presumably those are symptoms that are at least related to COVID. I think that's an FFCRA trigger. I think they're entitled to collect emergency paid sick leave regardless of whether they tested negative. There's another sort of tendril to that question that we'll talk about, I think, in my next answer, which is sort of my next question, which is going to be related to that one, which is how FFCRA interacts with Public Act 238. But for this one, yes. Sorry, the way it's phrased, emergency paid sick leave does not end. Yes, emergency paid sick leave continues. All right.
Nate.
Sarah, if someone had a probable case of COVID, in this example, the person's spouse was a confirmed positive, and then the person gets sick later, must they remain off work per guidelines?
Great question. So in this example, I think what this person is saying is that an employee had close contact with a person who tested positive, their spouse, okay? And then the employee also gets sick after that, okay? So we refer to, in this case, Public Act 238 and its requirements for how long this person must isolate and or quarantine. In this case, the employee has to quarantine for 14 days due to the close contact with his or her spouse. That means not go to work, right? They have to be home quarantining. As soon as that spouse tested positive, that employee is on notice. He or she had close contact with a confirmed case of COVID. That employee then is immediately in quarantine. Well, in quarantine then, the employee gets sick themselves. That starts the isolation requirements under Public Act 238. And we have to follow those isolation requirements to the T, even though the employee had already been in quarantine for part of that time, okay? So starting from when the employee first had symptoms, that employee has to stay home for 10 days after the first day of symptoms. and that employee also can't come back to work until they've been 24 hours fever-free without medication and all symptoms have improved. I'll also note that if the employee thereafter tests positive, the 10 days starts over from the date of the test that yielded the positive result. This question is a great example of what we're seeing frequently now, and we're going to be talking about in our responses to more questions. These quarantine and isolation requirements can stack on top of each other. They do not replace each other. So we can have an employee who's in quarantine, has been in quarantine for a week, and now starts with a separate isolation period stacked right on top of it. And when we have examples that involve households with kids getting sick, they stack on top of each other, on top of each other, on top of each other, unfortunately. Okay, Nate, this ties back to the last question you answered, but in this example, the employee doesn't have symptoms, but they've had close contact with a person with COVID, and then they test negative, okay, and they stay home, which they should do under Public Act 238. How long can they continue to receive paid time under the emergency paid sick leave provision of the FFCRA?
Yeah, so the answer is, assuming it's a full-time employee, the full 80 hours. And here's how this one works. If somebody has had close contact, and set aside, for example, for the moment anyway, any of the 190 odd executive orders that are no more, set aside the Michigan Department of Health and Human Services, set aside MIOSHA, set aside all of the guidance from the CDC, set aside everything except for Michigan law. This Public Act 238 is straightforward. It has very limited exceptions, almost all of which are in healthcare. And it says that if an employee has had close contact, he or she must stay away from work for 14 days. And that statute, 238, is almost certainly an isolation or quarantine order related to COVID-19, which would make it trigger number one under FFCRA. So under FFCRA, if an employee is subject to a federal, state, or local quarantine or isolation order related to COVID-19, that's an emergency sick leave trigger. In the example we have here, the employee is subject to Public Act 238. The Department of Labor has said that an isolation or quarantine order from work counts. It's not just an isolation or quarantine order from society. And so I think that the person stays home for 14 days under 238. I think they get emergency paid sick leave for that full 14-day period, assuming that they are a full-time employee. All right. Everybody still with us? I mean, I'm on to my second coffee, so this is a good time for me to ask. Number 10, if we are moving to using the Michigan Symptoms app, are temperatures required or suggested?
Excellent question. And just a reminder first, so under the MIOSHA emergency rules, all employers are required to have their employees do a self-reported daily health screening. Okay, and as part of that, the emergency rules say that that self-screening should include a temperature check if feasible. Okay, based on the language in those rules, it appears that it's no longer the case that the employer or one of you poor folks who are probably listening necessarily has to take every employee's temperature. They can take it themselves and self-report whether or not they have a fever. So I think this asker is wondering, if I move to that the Michigan Department of Health Symptoms Checker app to satisfy those requirements, what does that require with regard to temperatures? And I can tell you all that app asks the users about symptoms, including a fever. It asks whether the user has access to a thermometer, but it allows the user to answer no to that question and still complete the app successfully. Okay, so my view is it doesn't necessarily require that the individual take their own temp, and it certainly doesn't require that the employer do that. It follows the same protocol that I think most employers are following now, which is to tell employees when they answer that question, take their temperature if they can. All right, Nate, how about this? This is an easy one, I think, because we've mostly covered it already. Back to notification of health departments when we've got an employee who tests positive for COVID. Do we have to tell them each and every time we have an employee who tests positive?
Well, first, I want to note that that's an excellent question, because I've been observing that you've said that all these questions are excellent, and all of my questions are also excellent. In fact, I think they're at least as excellent as your questions.
Yes, but mine are better.
The answer is yes. And again, I'll make this much shorter, but look, your employees are going to find out. And I think you'd much rather them find out from you than from the rumor mill. If they find out from the rumor mill, then they're going to wonder why you didn't tell them. They're going to wonder, what else you're not telling them. It's going to, in my view anyway, raise suspicions and anxiety, which probably are already higher than normal. And so, from my perspective, you want to be the source of information. You also then position yourself to be the source of assurance and control. And people in a crisis need somebody to be in control. And for my money, that ought to be you. But the answer is yes.
Yep. And I'll just add to, with regard to notifying the local health departments, that is required under the MIOSHA emergency rules. So I would really encourage you all to do that. I know these local health departments are overwhelmed, and you all might not get a response at all. They might say the labs are telling us, don't worry about it, et cetera. And that's fine if that's the response you get. You don't need to push back on them, but you do still really want to check that box so that you're in compliance with the MIOSHA emergency rules. Just make an effort to notify the health department and leave it to them to follow up as they are able to do so.
Yeah, and that's a great follow-up point, and it just raised one other thing in my mind, which is, in general, I think employers have found any requirements or response from the health department to be, if anything, underwhelming. In other words, calling the health department doesn't, create a long list of to-dos that, will further complicate your life, or at least doesn't usually do that. And also, we don't yet have any evidence that calling the health department, multiple times gets you into any additional hot water with other agencies. And the reason there is fairly simple. I mean, if you're doing something wrong, you're not requiring employees to wear masks, or you're just not following your preparedness plan, that's one thing. But I think that state and local health authorities recognize that employees are getting COVID in all kinds of settings that have nothing to do with work. And so you might have 5 or 6 employees who all test positive because they're all friends outside of work and they all attended the same Halloween party. So that's not something that I think you ought to be reluctant to do. You have to do it, to Sarah's point. And to my original point, I think you want to do it.
Yep.
Okay.
All right. What's that
Number
for me?
12. And this is, this is a question. If there's any question that we're talking about today that we have gotten, I think, most often in a very divided country, it's this one. What do we do if an employee refuses to wear a mask? And in this particular question, the employer said, and what if they say they have health issues and need an ADA accommodation?
Yeah, I just want to say, Nate, that's an excellent question.
I agree.
Okay, so I think to lay the framework here, we need to remember that we are complying with, in Michigan, both the MIOSHA emergency rules that apply to all of our workplaces, and we are also separately following and complying with the emergency orders that we are receiving from the Michigan Department of Health and Human Services, the MDHHS. Okay? So most recently, about 2 weeks ago, we all know we got a new order from the MDHHS, okay, on November 15th. Both of those talk about employees being required to wear face masks while at work, but they say slightly different things. We have to comply with both of them, though, okay? So the MDHHS new order made clear again that employees have to wear face masks when in the workplace, right? When in any workplace gathering, and also said that there are a number of exceptions to the face mask requirement, one of which is for individuals who are unable to medically tolerate face masks, okay? So under the MDHHS order, it would arguably be acceptable for an employee to wear a face shield instead of a face mask if that person is unable to medically tolerate a face mask. But we have to remember we don't stop with just that order. We have to also look at the MIOSHA emergency rules, and they say something different. Those are much more they say clearly all employers have to require employees to wear a face covering if they cannot consistently maintain 6 feet of separation from others while at work. There is no explicit exception in the MIOSHA emergency rules for employees who have health conditions that impact their ability to wear a face mask in the workplace. MIOSHA has acknowledged that the ADA, the Federal Americans with Disabilities Act, and by the way, the Michigan law as well, the Persons with Disabilities Civil Rights Act, does require employers to provide reasonable accommodations in the workplace for employees if they need it because of a disability, and MIOSHA has acknowledged that it might be the case that an employer would allow an employee to wear a different face covering as a reasonable accommodation under the ADA. However, and by the way, MIOSHA has published a Q&A on this, so look on their website if you want to take a look at it. They are very clear, MIOSHA is clear that if you want to make an exception and allow an employee, for example, to wear a face shield rather than a face mask, they are going to be looking for documentation showing that you've gone through the ADA reasonable accommodation process, that you've required the employee to provide some sort of medical documentation to support that, and also that you've considered other alternative accommodations before allowing that face shield rather than a face mask. I think in MIOSHA's view, that would be a last choice accommodation They would much rather see some other accommodation that maybe would allow the employee to wear a mask, maybe extra breaks or something like that. And my guess is MIOSHA would say if you're going to allow a face shield, they would want that person to be working in a position for which they don't frequently have close contact with coworkers or the public or others. And again, there's a Q&A on MIOSHA's site, so take a look at that as well. All right, Nate, how about this? Thoughts on whether employers can pay employees holiday pay, for example, last Thursday and Friday, if that employee was off work for reasons that qualify for emergency paid sick leave under the FFCRA. I know I had a handful of folks reaching out to me with that question.
Yeah, and I think in this, at least the person asking this question has a collective bargaining agreement, which is the source of the holiday pay benefit. And I think the answer to this is pretty simple. I mean, you pay holiday pay based on your policy or based on your collective bargaining agreement, and you can apply any of the requirements that ordinarily are associated with holiday pay. There's nothing in FFCRA that requires you to pay holiday pay or prohibits you from paying holiday pay. So you pay it if your policy says you pay it, and if you're providing somebody with holiday pay, they wouldn't have worked that day, presumably, and so you don't have an emergency sick leave. It's treated like a weekend in a situation like that. But if you don't pay holiday pay, then of course their emergency sick leave just continues on uninterrupted. So to me, those are unrelated concepts.
Excellent.
All right. This is a wonderfully broad question, but also an excellent one. Tips on getting employees to be more open and honest about exposures.
Oh, there's no question that that's a difficult. I think we're all having a hard time managing this sort of public backlash when somebody tests positive for COVID and or is exposed to COVID, right? Because that sets in place a whole series of events, including you're supposed to stay home for 2 entire weeks that nobody really wants. And so I'm certainly seeing struggles here with employees not necessarily being honest or disclosing when they have, in fact, been in close contact with an individual who has tested positive. The first thing I'll say is, I can provide my thoughts, but frankly, I see I think probably many of the individuals attending today may have experiences or ideas on this too. So if you do me a favor and type that into the Q&A section, and I'll take a look and I'll share your thoughts. You probably may very well have more insight than either me or Nate. My thoughts are this. If we want to incentivize employees to be honest and open, the best thing we can do is demonstrate that employees are not going to suffer negative consequences for engaging in that behavior, right? So if we want to encourage employees to tell us they've been exposed to COVID so that we can make sure they are not in our workplace, then we're probably going to want to make sure they're not disciplined, they don't suffer any adverse action for having to stay home, and we need to make sure that we're paying them in accordance with the emergency paid sick leave provision in the FFCRA as well. I think that's going to be the biggest incentive. And that'll set an example for others as well. The easiest way to disincentivize somebody for being honest about exposure is to do the opposite of that, right? Employees have to stay home, then we discipline them under the attendance policy, which by the way would violate Public Act 238 and or they lose out on pay. It's unlikely that employees are going to, or less likely that employees are going to be honest and report that. Okay, Nate, how about this one? This is a bit of a long one, so I'll try to consolidate it. But to set it up, this involves an employee who has to be home because the employee's small child, has had close contact with a positive case of COVID at school. Okay, so the school calls the parent, says your kid can't come in because one of the students at our school has COVID, your child had close contact with them. The parent needs to care for the child and also can't isolate from the child while at home. The child is not positive themselves and has no symptom, they just had close contact. How long does the parent need to be off work? How long does the parent have a right to be off work, and do we pay them or not?
Yeah, so I think it's always helpful to look at degrees of separation. And if you get to 2 degrees of separation, then you may have some practical issues, but you don't have a situation where you have any Public Act 238 obligation, and you don't really have any MIOSHA or MDHHS obligation either. And what I mean by 2 degrees of separation is that you have been exposed to somebody who has been exposed. That doesn't trigger a legal obligation. Now, if that person who was exposed becomes positive, then of course you fall smoothly into the close contact camp yourself. But if that person is, if you have close contact with a close contact, then you are not subject to any of these requirements. So in an example where a kid has been a close contact or identified as a close contact at school and comes home, and now the parent is, of course, close contact, and presumably the parent is your employee, is close contact with the kid, then you do not have an obligation to keep that parent off work. That parent also, may now be, of course, eligible under FFCRA if they are caring for their child and if their child has been advised by a healthcare provider to quarantine. So you might have an FFCRA issue, but you don't otherwise have any obligation or requirement relative to your employee.
Excellent.
I don't know. Did I catch all of that?
Yeah, I think so, right. In other words, they don't have to quarantine just because their child was exposed, because that's secondhand exposure. But they have a right to stay home and take care of their kid under the emergency paid sick leave part of the FFCRA, correct?
Yes.
Yeah, okay.
Okay. And then my question back to you is also a relatively long one. If we send an employee home, if we send an employee home to quarantine because they notified us they were exposed to COVID, and we are paying them under the FFCRA to stay home in quarantine, and then we find out through social media that they did not stay home in quarantine and instead got together with other people and had others over to their home, can we refuse to pay them FFCRA? Can we discipline them? Should we notify the health department? What the heck do we do? Whoever asked
Yes.
that question is my MVP of this morning.
And many of you who are listening may also know that in non-COVID times, I spend a lot of my time talking about the FMLA and medical issues in the workplace, and often top of the list of topics for me include misuse of FMLA or dishonesty related to intermittent FMLA leave. And so I'm pleased to see COVID has delivered us our own version of that. And yes, I'm getting more and more questions about this too, all because of this lovely thing we call social media, right? So we know what employees are doing when they're not at work in a way that we never did before. And in this case, we know this person had direct contact with the case of COVID, so they're home because of it, and then they leave, get together with other folks, and gasp, also have people into their home when they're not supposed to be doing any of those things. So what do we do about it? Can we discipline that? I mean, what they've done undoubtedly violates Public Act 238, and arguably or possibly violates the current Michigan Department of Health order as well. It also could be dishonesty, particularly if we are paying them emergency paid sick leave because they are home quarantining. I would view that as potential dishonesty as well. So I think discipline could certainly be on our list of options, right? This is the type of situation that I'd want to talk to the client more about. I'd want to know how they've handled other situations like involving dishonesty before, what their work rules say. I'd want to know whether this is an at-will employee or whether there is a union contract in place. But certainly discipline could be an option. Should we notify the local health department? I don't think the local health department, well, first of all, there's no requirement to do that. And second of all, it's highly unlikely that the local health department has capacity right now to take action. You can if you want, but I don't think you're going to get a result there. I don't believe you can refuse to pay them emergency paid sick leave under the FFCRA, however. That is an entitlement that they have, and that entitlement doesn't go away because they've been dishonest, unfortunately. All right,
Good.
Nate.
We're getting close.
We're getting close, guys. Hang in there. We are now going to turn to a very, what I think is a hot topic right now as well, and that is the meaning of critical infrastructure under both Public Act 238 and under the CDC guidance. Okay, so in this question, the writer says, please clarify for us, and they are a food manufacturer. Okay, so under the CDC guidelines, food manufacturers are considered critical. So does Public Act 238 trump that? In other words, do those employees have to quarantine if they have close contact with an individual with COVID-19 or not? The CDC guidelines say one thing, Public Act 238 says another. I know Sean Egan, who's director of MIOSHA, has been a bit confusing on this front in his question and answer sessions as well. Please, Nate, provide us some clarity on this issue.
Yeah, so there's a lot of confusion on this issue, and it's absolutely clear that federal, state, and local health authorities are still referring to and using the concept of a critical infrastructure worker in their guidance and even in their requirements. And that concept arose originally out of the shutdown orders and was an attempt to separate who needed to continue to work, notwithstanding the shutdown orders, and who didn't. And it's not ever gone away, at least according to CDC and even according to Sean Egan. The problem is that Public Act 238, which is Michigan law, is absolutely unambiguous. And it doesn't allow for this concept of a critical infrastructure worker, doesn't require or refer to it at all. It certainly doesn't allow for it as an exception to the isolation and quarantine requirements. There are exceptions under Public Act 238, but they're far narrower than what you might think of as a critical infrastructure worker, and they're essentially all healthcare related. And so if you're a food manufacturer in this example, Public Act 238 does trump whatever other requirements you might be looking at least in the sense that if you bring somebody back earlier than Public Act 238 would allow, you are exposed to civil action under Public Act 238. I mean, you violated that statute. You can decide whether you think that risk is worth accepting, and you certainly have arguments based on some of the pronouncements of Sean Egan and others that there ought to be shortened quarantine periods for critical infrastructure workers. But there's no way around 238. It says what it says, and there isn't any exception that goes beyond the ones that are listed, and food manufacturers are not listed.
Thanks, Nate.
So I can almost feel the deflation over the line. Everybody just breathed a big sigh.
I know.
Okay, so we've addressed, I think, these are related questions. We've addressed the first, and the question is about the interaction of PPP and FFCRA. And as Sarah already said, you can certainly receive PPP, use it, spend it, and still take tax credits under FFCRA, as long as you're not taking tax credit for an employee in a week in which you're paying them out of your PPP loan. So as long as you're not doing it for the same person at the same time, there's nothing that says that you can't take advantage of both programs. But the question here is there anything different for not-for-profits?
No.
Awesome. All right. This is what happens down the home stretch. Our answers get shorter.
Yes, that's exactly right. Okay, Nate. This listener says, for a medical office, identifying which positions could be completed at home has been difficult. We have a couple of employees who we have determined either work at home or a portion of their work could be completed at home. However, they are struggling to maintain productivity. Can we discipline them for poor job performance if they are working remotely? And can we then make them come back in the office if they are not performing well at home?
Well, that is predictably an excellent question. I think, the first part of that question is easy. Absolutely, you can discipline or discharge somebody who is not meeting your legitimate expectations, including your productivity expectations. And it doesn't matter whether they're working at home or on site. They're your employee and they're supposed to do their job. So you absolutely can discipline. The more interesting part of this question is whether the person's failure to maintain productivity standards can essentially tractor beam them back to work? In other words, can that make their remote work infeasible such that you can justify having them continue to work on site? And I think the answer to that question probably depends on why they are not able to maintain productivity expectations. If they're not able to maintain it because they don't have the right infrastructure at home, they don't have the right technology, or they don't have the right equipment, or they don't have the right support system, then I think the answer is yes. You tried to have them work remotely, consistent with MIOSHA's expectations, and it didn't work. In fact, I think that probably creates a better argument for you that this was not feasible than if you would have assumed that it wouldn't be feasible for those same reasons on the front end. So if that's the why, then I think the answer is yes. If the why is that the employee is just taking advantage of their remote work time to watch Netflix and play video games, then I think the answer is no. I don't think that makes their remote work infeasible. I think it probably makes that employee infeasible for you, and you might decide that they should seek better opportunities elsewhere.
Okay.
Sarah, do you expect any restoration of protections for people in the vulnerable population, such as unpaid leaves of absence that were previously stated in executive orders?
Okay, so I think this listener is referring to sort of when we had the barrage of executive orders from Governor Whitmer, there was a line of executive orders that applied specifically to food selling establishments and pharmacies. And within those, there was a requirement that the employer had to provide a leave of absence to employees who were vulnerable to COVID-19. It was sort of a strange one-off. It wasn't in the other executive orders, just in that line of executive orders. As we all know, those executive orders have gone away. We have not seen that requirement surface again through the DHHS orders or the MIOSHA emergency rules. And quite frankly, I don't expect that it will. I think MIOSHA and the DHHS has concluded that employers should handle those cases in accordance with the ADA, and I don't think they're going to have a separate requirement like that. All right, Nate, and for the listeners, we are almost done. We just have a couple more questions to go. Nate, if an employee and their spouse had COVID a few weeks ago, and now one of the 3 kids has tested positive, how long is the quarantine for the parent, since it's a small child and there isn't a way for them to quarantine or isolate? I would think they would have to quarantine. I wouldn't think they would have to quarantine for another 14 days after the 10 for their child. Okay. Remember earlier I mentioned that quarantine and isolation requirements stack on top of each other, on top of each other, on top of each other. I think this is an example of that. So what's the requirement going to be here, Nate?
Yeah, I'm afraid I'm going to disappoint the person who asked this question because the Public Act 238 requirement is 14 days from your last close contact. And when you have a small child at home and there's no way to quarantine or isolate from them, then that requirement just sort of rolls. It just continues. You have close contact on Tuesday and you've got a 14-day quarantine period, but then you have close contact again on Wednesday and you have a 14-day quarantine period. So it just continues on until you no longer have close contact with that person. And in this example, the presuming that you're going to have close contact with that child all day, every day, what you really have to do, unfortunately, is exactly what this questioner hoped that you wouldn't have to do, which is allow the child to complete his or her isolation period and then run your quarantine period from that point. So the 14 days in that example probably does stack on the 10.
Yep. And just to be clear, I see a question that's come in during the webinar, and I think this ties to the question you just asked. I mean, in this case, the employee had COVID and recovered. And so the question is, well, do they really have to quarantine now if we know they've already had it? And my thought, Nate, is that unfortunately, Public Act 238 doesn't have a back door in that circumstance. It doesn't say, but you don't have to quarantine if you've already had it. And therefore, and I think the reason for that is we're not entirely certain yet what it means if you've already had COVID and get exposed again. We don't know yet whether or not you can have it twice or whether or not you can carry the virus, et cetera. So unfortunately, even if you've already had it, Public Act 238 still requires the 14-day quarantine if you have close contact with somebody after that.
Yeah, I think that's right. I mean, 238 does not have a critical infrastructure exception. It doesn't have a test negative exception, and it doesn't have an invulnerability exception. So, I mean, it is a very straightforward statute in that respect. And unfortunately, MIOSHA and MBHHS don't always show any obvious signs that they've read that statute.
Yep.
Okay. Next question. Where are we in all of our questions? That's a good question. My question for you is, what question am I supposed to be asking you?
Well, we do have to tell the audience that we've been chasing our tail a little bit because we've had like I don't know how many iterations of the list of questions, right? They just keep coming in and coming in and coming in. So we apologize. Nate, I think there were some emails that we received yesterday with questions. Do you want to ask me one of those?
I do. So what about an employee who, or an employer who has multiple sites across multiple counties and wants to know, okay, well, what about this COVID coordinator requirement? Can we have COVID coordinators out of our main office, or do we need to have one at every site?
Right.
And, you know, if sites are closed, do we have to have a COVID coordinator on site? In other words, what is this COVID coordinator expectation if you don't have just one location?
Right. And so really what MIOSHA seems to be requiring in its emergency rules and envisioning is that an employer like that might have one person that is generally overseeing all the COVID things, right? Kind of the expert, Nate for Miller Johnson, perhaps, right? But then in addition, MIOSHA requires each individual site to have a COVID supervisor. And that COVID supervisor has to be on site. They've got to have somebody who can fit that role on site anytime you've got people working in person. Now, the great news is that doesn't all have to be the same person, thank goodness, right? The COVID, the person that oversees COVID in general is not supposed to be at all of our sites all of the time. Instead, an employer can assign that COVID supervisor job to whoever it wants. And if we're being strategic, obviously we would assign it to a person or a couple of different people who are going to be there anyway, right? So if you got 3 shifts, how about your first shift supervisor, your second shift supervisor, your third shift supervisor? That individual at a minimum should know how to get a copy of the COVID-19 preparedness plan, should know what it says, and should have received the COVID-19 training that's required in the MIOSHA emergency rules. I'll also note I've had a couple of times where I've been talking to clients about specific employees who really, really, really want to work in person, but it's a close call as to whether or not it's appropriate to allow them to work in person under the MIOSHA rules. How about you make them your in-person COVID supervisor? Okay. All right, Nate. By the way, I see one question that I'm just going to answer because a couple of different folks are asking it on the webinar, and we received it in an email too, and that is, when is Public Act 238 going to end? Like, we got them really excited, Nate, when we told them the FFCRA has an end. And people are wondering, what about Public Act 238? Does that have an end? And I got really bad news for all of you. It does not currently have an end at all, not even tied to the end of COVID. I'm not quite sure what our Michigan legislature was thinking, but for now, there is no end to Public Act 238, and we may, in 3 years, still be talking about employees who can't come to work for 10 days because they have a fever, even though our global pandemic has ended. Okay.
Oh, that was depressing.
Yeah, sorry about that.
Yeah, maybe. I mean, when I look at the rest of the questions, I think that we have addressed them with one exception, which is somebody asking about information on how to create a policy prohibiting in-person work. And although I think you just answered 2 questions in a row, I think that's a perfect question for you as the manager of our resource center.
Yeah, so under the MIOSHA emergency rules, employers are required to have a policy prohibiting in-person work unless it is not feasible for that person to work remotely, okay? And MIOSHA has also published a few Q&As clarifying what it means by a policy. It does, in their view, need to be a written policy. It can either be part of the preparedness plan or it can be a standalone policy. But that policy has to also include a process by which the employer can demonstrate that it implemented that requirement. In other words, it looked at office positions in particular and other positions for which employees can work remotely. It thought about it and it reached a decision that makes sense, okay? The policy has to talk about which positions can work remotely, which can't, and why. And I will tell you that as part of our resource center, many of you have heard me talk about the resource center, but if you're not familiar with it, go look on our website, Miller Johnson, and click on COVID-19, and you'll see a link to the resource center. We've got both a framework for a policy for a COVID-19 temporary remote work policy and a form that employers can use to engage in that required assessment by MIOSHA to satisfy those requirements. So with that, Nate, I think we have answered all of the questions we received. Only 15 minutes over, which is a small miracle. So thank you for thank you to all of you who stayed on. I know Nate and I had a really good time. We appreciate you guys attending, and we hope you have a fantastic rest of your day.
Bye, everyone.